any point we need to stop or anything like that, you just let me know.
Okay, sounds good.
I have everybody do this. I'm sure you did this already, but just say and spell your first and last name and tell me your title.
Sure. So my name is Dr. Michael Alasco, Michael-Alosco, and I'm a clinical researcher and postdoctoral fellow here at Boston University CTE Center.
Gotcha. And how long have you been here?
So I've been here for 2 years now.
Gotcha. One of the, all this data that stuck out to so many people, I think especially in the column of the NFL players. Right. That made all the headlines. 99% of the NFL players had CTE. When you looked at not only that column, but all the way down to pre-high school, right, did the data surprise you?
Right, so that was the most surprising find to me actually, was the findings that we're finding CTE kind of across all of the levels of play. It was really remarkable that we found it from high school all the way up to the professional football players, kind of further raising concern about playing football, kind of no matter what age or level you're at.
Why was that surprising to you?
Because, we've been seeing, if you go back to our 2013 study, which was on a much smaller scale, we're seeing CTE often in the people who are professional football players that donate their brain. And so it becomes more surprising when we see it in younger age groups and people, particularly people who just play at the high school level, just because, it indicates that there's different amounts of levels of hitting your head that can result in CTE, and we got to figure out how much is too much.
Okay. Was there any really conclusive? I know that you guys have noticed links between behavioral and mood changes, right, specifically like anxiety and depression, impulsivity. Were those conclusive links between having CTE and those behavioral changes? No,
you can't say conclusive. So you're right. We do see these symptoms of behavior such as aggression, as well as mood changes like depression, and then also thinking and memory problems. But a lot of these symptoms are nonspecific, meaning that we see it in a lot of different conditions other than CTE. Really, we need to find out which of these symptoms are specific to CTE, and that will ultimately allow us to, detect and characterize it in life.
Mm-hmm. Really quickly, is there a way for a person who, I guess, has whether it be mild or severe while they're living to ever possibly recover or in any way from CTE?
We don't know that. The first step to that question is to be able to diagnose it during life first. Once we can do that, then we can kind of track the disease over time in living people. But yeah, we don't know that answer to that question.
Can you tell me a little bit about the research that you're doing with Dr. Stern, without giving it all away, about
right,
what those methods are, how you study it in people that are living? Because that's the big future question.
Sure. So they're at Boston University here. We're conducting these large studies that involves multiple sites across the country that are following football players across time. And we're looking at a whole bunch of different technologies, different tools, and novel ways to look at the different proteins in the brain and in the blood, as well as kind of structural changes in the brain, as all possible ways to detect CTE in life.
Okay. There were a number of things that we talked about as far as the limitations of the study that you guys came up, obviously as part of being a peer-reviewed journal, came up front and said. What did you think about some of those limitations, specifically the one about kind of the selection or volunteer bias? Because basically
right,
the people who are donating their brains to you say, we believe, I guess, they may have some type of brain injury, right?
Right, exactly. So that's a critical limitation. So this is true across all kind of brain donation programs. People who are more likely to donate their brain, there's a certain bias associated with that. In this case, people tended to be symptomatic, so they were more likely suspected to have some type of pathology. So what that all means, though, is that we really can't generalize the findings from this study to the larger general population. We can only kind of generalize it to the sample that we have, which is football players who agreed to donate their brain.
Okay, but can you extrapolate it to football players in general? Because not the general population,
right,
but can you do it to just a population of football players?
Our findings are really kind of restricted to the sample that we are dealing with, in that these are people who agreed to donate their brains and had exposure to football. So so it's harder to generalize to the general population, including all football players in general.
Were you able to determine if the length of time playing football, for example, somebody who's played maybe a year or two versus somebody who's spent their entire life, maybe from age 7 all the way to 37 playing in the NFL, playing football, did that have an impact on whether they had mild or severe manifestations of CTE?
Well, right. So the individuals who played professional football were more likely to have more severe pathology, whereas the less severe pathology was found people who were younger, and as well as kind of down to those who played high school as well. So that's kind of start drawing some inferences that professionally, if you play football, it seems like there's more severe pathology, particularly as you get older.
Does that have to do with the length of time and the number of repeated hits, or does that have to do with as you go to college and you start to play in these higher and higher levels where the players are bigger and stronger and faster, that the hits are harder? Is it the length of time or the intensity of each hit?
Right, great questions. We don't know. It could be all of the above. We need to really study and look at, is it the length of time, is it the number of hits, is it the type of hits? Kind of all these are different factors that could either increase or decrease or modify some way your risk for CTE, and we need to figure that out.
So what would be the big takeaway for you from this study that you did get that you can tell the public?
I think the big takeaway is the sheer numbers. We found CTE in 177 out of 202 American football players. 99% of NFL players had CTE. I think it's raising tremendous concern. It's really highlighting a link between prior participation in football and CTE, and it's something that's here, that's a problem, and then it needs to be addressed.
Is there a way to address it at this point? I mean, whether that be equipment or changing the way the game is played? I know that sounds ridiculous, but is there a way to address it that you would, I guess, think of right now?
Well, I think we still need to do more research before we can really advise on recommendations for policy or safety. I think we really need to kind of put our heads down, figure out what the specific risk factors are, what are the mechanisms, and once we can get a better idea, then we'll be more informed to make these type of decisions.
Is it scary, I guess, for parents when they see a study like this and they say, "Oh my gosh, a person who plays football is more likely to get CTE"?
Right.
Did you have any reaction like that from anybody you know?
Yeah, well, as a parent myself, I think it certainly raises concern, and it should raise concern, or at least make you think twice. But all this comes in mind with the benefits of sports as well. That you can't ignore. But again, the more we figure out and the more research we do about this disease, the better we'll be able to kind of make these decisions.
Was there any consideration to do a similar study, or maybe it may come with the actual brain donations, that may be part of it, but different sports, maybe boxing or hockey or soccer, somewhere else where you might have similar repeated blows to the head? Yeah,
so this study just focused on football, but we have, other studies of ours and as well as independent of ours have found CTE in different contact sport athletes. And there might be differences in how CTE presents based on the type of head trauma. But yeah, we need to look at it across all contact sports and see kind of what the differences are.
Okay. Let me just look over these really quickly. Well, let me ask you this. You've got kids. Would you let your kid play football?
So fortunately I have a daughter. But again, like I said before, I would have concerns, and I would have to seriously think about it and make an informed decision once we know more about the disease and the risks associated with at the different levels of play.
Do you think, as we talked about a second ago, do you think a parent should be concerned, or is there maybe some type of grain of salt to take with this study if you're a mom or a dad who has a kid?
Right. So, we can't take our findings and extrapolate them to every single individual that's played football in the United States. We don't know what it means for every person. Every person's different. There's likely other factors that interact with exposure to hitting your head a bunch that may increase someone's risk, and we don't know what those factors are. So it's hard to say. You know, every person should be treated differently, and we really just need to figure out more before we can properly evaluate who's at risk and who's not at risk.
What does this mean for, you know, we saw so many NFL players who decided, look, I'm done, I don't want to play anymore because of concussions.
Right.
Do you think a study like this would make more people in general, whether they're NFL players or not, think twice about playing?
I mean, I would think so. I mean, the numbers in themselves are scary. It is scary. So I would think that when people see these numbers and see our findings, that it does raise a lot of awareness and present with some concerns.
Other than the sort of the behavioral changes that you guys noticed, were there any other ones that really stuck out as far as real degenerative issues of the brain?
Yeah, so I mean, one of the common symptoms we see is progressive worsening of things like your thinking abilities and your memory. And oftentimes what happens is those progress to the point where you can no longer do tasks like paying your bills or driving, what we've referred to as dementia. And so that was very, you know, it's very sad and very distressing for families and the individual to go through.
And this comes from not necessarily those railroad hits, it's the subconcussive repeated head trauma, is that right?
Right, so that's what we think now. Definitely we think it's these smaller, repetitive, you know, thousands and thousands of head impacts over time that don't necessarily translate to clinical symptoms right away, but it's just kind of these silent hits to the head that add up over time that we think are kind of like the prominent contributors to CTE.
Mm-hmm. Gotcha. I think that's kind of it for like my really like clinical questions. I'm just wondering if you have any kind of opinions. I mean, how does it feel when you're finally getting all this national media attention for a study that is such a hot button issue, and it's not necessarily something that's new?
Right. I think it's great. I think this study is providing a really rich source of data of what this disease, what CTE looks like in terms of in the brain and clinically. And I think it's really going to provide a foundation for future research and provide more and more resources for not only here, but for everyone to kind of, all clinical scientists to study CTE and learn more about it.
Now, this was one of the most pervasive, I think, as far as its sample size, right?
Right.
The most number of brains studied at one time, and then also the age ranges as well, right?
Right.
How does that affect what you can say about the study, about its findings, compared to studies in the past?
Yeah, so in 2013 we had a study that was similar to this but on a much smaller scale, so this one actually doubles that study. So I think it's the numbers. I mean, it speaks to the volume that, you know, we're finding this in 177 out of 202 football players. I mean, it just raises, you can't ignore the numbers.
Was there a reason why you picked football players specifically?
So we've been studying football players because of their exposure to these, they have the most exposure to these head impacts. So they offer a population where we can really study head impact exposure and CTE.
There's been so many developments from, you know, even the time I was a young kid.
Right.
The way the equipment has changed, the way the style of teaching, tackling, and football in general has changed. Do you think that would manifest in a different percentages if you were to do this same study,
right,
10, 20 years from now?
So yeah, so I think there are some differences in who might develop CTE or not. We don't know this yet, but maybe people who began to play in an earlier decade, you know, in terms of when youth tackle football started, or differences in styles of equipment or differences in play. All of those are different possible risk factors for CTE, and those are all things that we're looking at BU.
That can be, you know, one of those things. Again, I kind of just go back to a parent. You know, I used to work with kids for a long time, and just thinking about, you know, as a coach, you're responsible for these kids every time they go out on the field. And while hits to the head are not, there's no way to completely prevent them.
Right.
You know, is that something that for parents that you could say, look, you can't just say football's a dangerous game, or can you?
I mean, football in general, I mean, it's an aggressive sport. I mean, not only in terms of hitting your head, but just in general. But like the study shows, there's concern for if you hit your head repeatedly over a long period of time. It seems like it's closely linked to some type of later life problem such as CTE.
I think that's kind of. I have a million questions, but I know you don't have time for that. So, is there anything that we haven't covered that you want to make sure we cover?
I think you hit on all the big points, the major points. There was a question. The second question you asked me, I think, about the high school. I don't think I was clear on that one.
Okay. Well, here's what I'm going to do. I'm going to change up the shot real quick.
Okay.